Hello friends, today we are going to see about what is constipation. So constipation is the most common problem during the defecation process. So what all can constitute constipation? It is not just passing tight stools. So there can be decrease in the frequency. Like one who was passing once daily, now he is finding difficulty in passing at least twice a week. Then it can be constipation. Second, the amount of stools passed. One who used to pass good amount of stools, now the amount of stools is coming down, that can also be constipation. Number 3, stool should be a semi-solid, paste-like in consistency to be able to pass it very easily. But when it becomes very hard or pellet-like, again that is constipation. It should be passed freely without lots of strain put on it. But when one has to strain a lot to evacuate the stools, again that becomes constipation. So what all can contribute constipation? Again, dietary habits, less of fibers is the most common cause of constipation. It can also be caused by recent viral illness, fever, not consuming water properly. These are all very common problems. Now certain systemic conditions like hypothyroidism, one who has less thyroid in their body, diabetes, these two are the most common systemic conditions which can lead to constipation. Now I didn't say anything about the gut. So out of 100 people who have constipation, routine causes and systemic causes contribute about 80% of constipation. Remaining 20% only is caused by certain problems within the gut. Now what all problems can cause constipation pertaining to the gut? It can be a block in the large intestine, which can be in right side of large intestine, left side of large intestine, or in the terminal portion of large intestine called as rectum. Or it can be caused due to dyssynergy, like propelling the motion forward is a synchronized coordinated movement of the gut. So when the synchrony between the rectum and the anus, the lowermost portion of the large intestine, and the anus goes off, what happens? Rectum tries to push it out, but anus doesn't relax. So this can also lead to constipation. So whenever you face any of these problems, do consult a doctor, get yourselves examined. Not all require any special investigations or so. Certain things are very easily treatable with dietary modifications, and if they are identified to have some systemic diseases like thyroid and diabetes, controlling them can lead to improvement of these. If you have not having any of these issues, then it's all the more important a gastroenterologist or a surgeon or a physician examines you and rules out these conditions like a tumor or a stricture or a dysynchrony of rectum and anus to be ruled out, because each has got its own treatment. So whenever you have constipation, don't shy off, consult a doctor and get yourselves treated. Thank you.